The pregnant patient is at no greater risk of contracting COVID-19. The risk of the pregnant patient is that as to the non-pregnant population. I think it gets a little bit more complicated because we know traditionally that the pregnant patient has an is an immunocompromised or suppressed state. But we would say generally that in the general population of pregnant patients, we can expect that if they do contract COVID-19, it should be a mild disease with only a small number of patients suffering from severe COVID-19 disease.
How has COVID-19 changed the way that you are operating?
Well, certainly you can look at me and see I'm wearing a mask, you're wearing a mask as we conduct this interview. It has meant generally that we've changed how we do things. We have reduced the number of elective things which we do. That can range as simply as things such as your annual well woman checkup. We've certainly stopped doing those things. We've also reduced things such as elective gynecological surgeries. So maybe a patient who had uterine fibroids, and if she was anticipating surgery for that, we have stopped doing those things. We've also looked at how we conduct ourselves in the office, and we try to adhere as much as possible to social distancing. So we have spaced our appointments. So normally you may have had a 15-minute slot, a 20-minute slots. We're certainly allocating more time towards our appointments just to make sure we minimize the traffic in the office.
What are some of the challenges that you're facing?
Well, some of the challenges, we've also told our patients that they cannot bring their partners to their visits. They can't bring their children along to their visits. So that's a little bit challenging for the patient to hear that, because normally pregnancy is a time where it's a family affair and everyone gets really excited about it. So it's disappointing for the patients in that respect. For us, it's keeping everyone in the workplace safe. It's keeping yourself safe, wearing your mask at all times, asking the patients to wear masks, doing things such as cleaning all of your surfaces that are frequently touched on a regular basis, cleaning door handles, cleaning beds, cleaning table surfaces and chairs, and just trying to keep the area as clean as you possibly can keep it, and of course frequent hand washing.
I'm sure you encounter high-risk pregnancies that will require more monitoring than a normal pregnancy, but how are you guys dealing with that?
I think we all know that antenatal visits are necessary in pregnancy, and there's no getting away from that. If you have a low-risk patient, we can definitely space appointments. If you're a high-risk patient, you need to collaborate, you need to speak with your doctor regularly, and your scheduling will be done accordingly. But if you need to come weekly, if you need to come every 2 weeks, then we stick to that schedule. Occasionally, we are doing some televisits, so we use other media, we call our patients, and we can have conversations with them, find out how they're doing. But on some occasions, it remains very necessary to have in-person visits, so we think that patients should stick to that schedule. Whenever we're speaking about pregnancy, we're speaking about at least 2 patients. So there's mommy and there's baby. We know little about COVID-19. It is new. So far, we believe that there are no teratogenic events, and that essentially means we think it does not harm the baby on the inside. All babies have come out. They look normal when we look at them, and they appear to be fine. Initial studies coming out of China told us babies and pregnancies, or the babies, were not affected at all. When we tested the water in mommy's tummy, it was fine. Vaginal secretions were fine. Breast milk was fine. And from that, we took away that the babies were likely to be unharmed. We have some newer studies coming out. When we check baby's blood after pregnancy, we've actually found antibodies in the baby which means that babies have been exposed to the virus while they are in the tummy. So far, those babies look normal, but as you can imagine, we will have to screen those babies 6 months, 1 year, 5 years, 10 years from now to see if there's any long-term effect on those. As it relates to the mother, the virus is usually expected to be mild, but as you can well understand, if we have a COVID positive mummy coming in, we're dealing with 2 patients. There's several teams that we will need to actually bolster her management. We're going to need a pediatric team. We're going to need an obstetric team. We would need an internal medicine team who looks after things such as pneumonias. You're going to need your anesthetist in case that mummy needs to be delivered by cesarean section. So the COVID-19 positive pregnant patient is a unique patient that brings special things to the table.
What advice do you have for expecting mothers during this time?
I advise expecting mothers, keep your appointments. You don't want to be canceling or missing your appointments at this time. Be in constant dialogue with your obstetrician, with your polyclinic, whoever is performing your care. Constant hand washing. No touching the face, no hands going into the face. Wearing of the face mask when you go out. The usual advice, stay home. If there's no need for you to go out in public, stay home. Let the other members of the family do the shopping, do the necessary things for you. And of course, just try to be safe.